Here are some additional thoughts and resources that you can use to use leadership skills to combat stigma and to address the COVID-19 pandemic. Followers as well as leaders can cause change to happen. This means that you can show leadership even if you aren't a quote-unquote leader. Some things that work in gaining influence with existing leaders include knowing the leader's needs, being seen as the go-to person to get some task or effort addressed, providing information quickly in an easily understood way, or having the ability to accomplish some task that others find difficult. Social distance is the difference between two individuals' authority or rank. Reduce your social distance by being available for activities where you can interact with the leader you want to influence. Build coalitions to increase your safety by increasing the number of people seeking the change. It is useful to develop culturally competent care, which facilitates colleagues to more readily seek the help they need. But this doesn't remove the need to provide help based on events the team is experiencing, such as continuing pandemic stress, the loss of a team member, a particularly grisly scene, or the loss of a child, or profound injury. Job-related stress increases in times of pandemic, and events may be overwhelming now that were previously dealt with successfully. Critical incident stress management is designed to help individuals and teams deal with the recurrence or increase in substance or mental health disorders or family issues. Critical incident stress management, or CISM, is not psychotherapy, but is rather a confidential, voluntary, and educative process, sometimes called psychological first aid. This allows the team or individual to share experiences, vent emotions, learn about stress reactions and symptoms, and receive referrals for further help if required. Pre-crisis education, debriefing, diffusing, grief and loss sessions, crisis management briefings, critical incident adjustment support are techniques that may be applied after a critical incident has occurred. This could also include hot wash and critical incident reviews undertaken with a team that experienced the loss. Sherry Cardinal lists the tools for CISM as debriefing, which is a proactive intervention involving a group meeting or discussion about a particularly distressing critical incident. Diffusing. This is an intervention that is a shorter, less formal version of a debriefing. It generally lasts about 30 to 60 minutes, but may go longer, and is best conducted within 1 to 4 hours after a critical incident. It is not usually conducted more than 12 hours after the incident. Grief and loss sessions are structured group or individual sessions following a death and assist people in understanding their own grief reactions. Crisis management briefings are large, homogeneous group interventions used before, during, and after a crisis to present facts, facilitate a brief controlled discussion with question and answers, and information on stress survival skills. Critical incident adjustment support provides multifaceted humanitarian assistance to individuals, families, or groups for coping with the aftermath of an incident and overcoming the ongoing impact of a death or injury. Pre-crisis education provides a foundation for CISM services. It includes incident awareness, crisis response strategies, and develops stress management coping skills that can prevent major problems should an incident occur. If you or someone you know, whether police, firefighter, EMT, healthcare worker, friend, or loved one, is experiencing the following symptoms, especially if multiple symptoms are present or repetitive, please seek help immediately. That is, chronic stress, depression, anxiety, anger, intense irritability, aggression, alcohol use disorder, formerly called alcoholism, substance use disorder, formerly called addiction, hopelessness, isolation and withdrawal, suicidal ideation, that is, thoughts about suicide, how suicide would happen, or where it would happen. Talk of suicide, where someone frequently talks about suicide or says that suicide is a solution. As Kim Colgrove, who compiled this list, tells us, in 2014, I lost my husband, Special Agent David Colgrove, a 30-year veteran, to suicide just after he retired. As a result of that devastating loss, Kim founded the Pause First Project and has turned her attention to bringing relief and resilience to first responders through mindfulness training. It bears repeating that if you or someone you know is having these symptoms, particularly if more than one or if repeated episodes, then get help for suicidal ideation or suicidal actions. Another tool you should put in your leadership toolbox is Memorize 273. Why? Because you already know 800 is for toll-free and talk is the way to help, so putting it together gets you the way to get help for suicide. That is 800-273-TALK. 273 is the key for getting help.